So I think we heard this morning that Ring 20 was described first in 1972, and overall prevalence of any ring we also heard pretty high actually. And essentially by 2012 about 100 cases had been described, but the fact that we are nearly 22 families here clearly means that this is an underdiagnosed disorder, and there would be many more or maybe hundreds of patients that are undiagnosed and are just suffering with refractory epilepsy. Now, Ring 20 related epilepsy is something that is described as an epileptic encephalopathy. And because it is associated with major cognitive and behavioral problems, and typically they seem to start once you have developed epilepsy. And we have heard David's story this morning and Dale's story this morning. And pretty typically, they are doing quite well before the onset of epilepsy. And as the epilepsy becomes more and more difficult to treat, and refractory epilepsy, then you start seeing problems with cognition, behavior, learning. And that's the concept of epileptic encephalopathy, which means that the epileptic activity itself is contributing to your cognitive and motor performance. So as a corollary, if you are able to manage epilepsy better or contain that epileptic activity storm in the brain, then you might get some improvement. That's a corollary. Whether that is achievable or not, that's always difficult to predict. But essentially, the epileptic activity drives the problem beyond what you would expect with the underlying disorder. Epileptic encephalopathy, there are different epilepsy syndromes, and they are quite age-related. But essentially what this means that with the epileptiform activity, you will have a high probability of a patient developing encephalopathic features. And that's a very broad term to describe any sort of brain dysfunction as an encephalopathy. It doesn't have to be somebody who is sitting in the intensive care or lying in the intensive care with encephalitis, but it is a very broad presentation. And so that essentially the key bit is that is present or worsen after the onset of epilepsy. And that can be driven by the underlying cause itself, but it can be epileptic activity driving that, and both. And I think it's important to know that Ring 20 is one of the epileptic encephalopathies. Now, we also heard that Ring 20 chromosome almost always is associated with epilepsy. And in fact, the epilepsy that leads to a diagnosis, because before that, there aren't very many ways of predicting the diagnosis because they don't have any typical facial features that one could recognize. They don't always have, most of the times, they don't have any structural brain abnormality if you did their scans. There have been case reports of cortical dysplasia, brain abnormality that is associated with Ring 20, but just occasional ones really. And the seizures that develop in Ring 20 are quite age-related. Change in their pattern is quite age-related. If they start having seizures in early life, as in neonatal period and early childhood, they don't have any typical pattern that we tend to see subsequently. And then the seizures evolve more as you get older. And then when you have these focal frontal hypermotor seizures, so lots of thrashing, jumping, kicking, rocking, and nighttime seizures. Ictal terror, we already heard about ictal terror and different manifestations of that ictal terror, visual hallucinations, spiders, wolves, blood, all those things really. They have automatism, so the automatisms can be manual, as in sort of rubbing or fumbling, as Dale described, and also automatisms that can be oral automatisms like chewing, lip smacking, gulping, those sorts of things. And there are these tonic and nocturnal seizures, and again, those who have seen seizures in their children, you are all very familiar with what the seizures look like. And sometimes the nighttime seizures are difficult to identify because they may not show anything beyond stretching and arousals, and these are called subtle nocturnal seizures. We also know that the children who are non-mosaic, as we heard from the genetics talk this morning, so essentially they have more severe phenotype, they have earlier onset of seizures, and if you have mosaic, then you tend to have later onset of seizures and less likelihood of, or less intellectual disability with mosaic pattern, because clearly not every single cell in your body is affected with Ring 20. And obviously if you had every single cell affected with Ring 20 that's associated with deletion, as we heard early this morning, you are going to have more severe epilepsy, earlier onset epilepsy, more severe epilepsy, and more consequences from the epileptic encephalopathy. Where are we? The non-convulsive status epilepticus, which is again a state of prolonged confusion and prolonged absence, many people might call this, is again quite typical for Ring 20. They often seem to develop that in the afternoon, and we have heard that, and I'll show you just a very quick EEG picture after that, really. The onset of epilepsy is, again, in the first few years of life. Very rarely ever they will have epilepsy onset beyond 15 years of age. There are only occasional case reports. So majority of the clusters of epilepsy onset you are seeing in the first 10 years of life, really, 10 to 12 years of life. Different seizure types have been described, but there was one. So this is a girl who started having seizures at 9 years of age, and these seizures subsequently evolved to her having ictal smile and laughing. And often these laughing seizures, we suspect specific sorts of pathologies in children, and there are specific conditions that are associated with ictal laughter, or what we call gelastic seizures. And so it's not very commonly described in Ring 20, but this is one of the girls, one of the cases where it is described. I don't know if there is any volume to this, actually. I better not fiddle. So it's the laugh without any mirth, actually. So there is no reason for her to laugh, and this laugh is associated with abnormal EEG. And then you see more typical manifestations of her being confused and automatism and fumbling and being unresponsive. You also see change in her facial expressions. But the seizure onset is her becoming a little blank and having that ictal laughter for which there is no cause, really. So the laughter is not out of any happiness, but it is just the part of her epilepsy. So essentially that means that the clinical manifestations of epileptic seizures in Ring 20 can be a lot more wider than what we appreciated before. Sorry, I'm going wrong way now. Hang on. Finish down. Okay, and that's a typical pattern of non-convulsive status, and this is from one of the patients that I know, where this person functioned perfectly well between 7 in the morning and 2:30 in the afternoon. As soon as it is 2:30 in the afternoon, that's what her EEG looks like, and this will carry on all through the day, all through the night, and 7 o'clock in the morning, all the storm calms down, and she's fine again. So that's a typical pattern of non-convulsive status epilepticus, and you can recognize that the functioning during this time is not optimal at all. The long processing time of information given to her, she doesn't remember, the school doesn't go well, as you can imagine with that sort of pattern. So essentially coming to treatment of epilepsy. Now, any epilepsy treatment is going to have 4 predominant arms, if you like. The most common and standard arm of treatment is anti-epilepsy drug. Then there are dietary treatment, and I'll talk about ketogenic diet in a bit more detail. Then epilepsy surgery, and then neuromodulation therapy. And Sophia will talk about neuromodulation as in vagus nerve stimulator implantation and probably DBS. Sorry. And I think the anti-epileptic drugs, we already heard this morning that it is associated, Ring 20 related epilepsy is associated with refractory epilepsy, which means that they don't respond to any consistent anti-epilepsy medication. Often you end up requiring more than one epilepsy medication, and that is what we call polytherapy. And there isn't one consistent medication that clicks for an individual person. And part of the problem is that we don't actually know how the anti-epileptic drugs work in all the cases. And often the specific mechanisms that we hope that the anti-epileptic drugs will work is not often clinically relevant. And many times the drugs come on the market with very little understanding of how they work and why should they work and what sort of seizures they should work. We have some broad understanding, but that is not something that we can extrapolate to an individual case all the time. It has become almost illegal not to show this slide in any epilepsy drug-related talk. But essentially what this slide shows that your best chance of success with any epilepsy medication is your first 2 medications if they're appropriately chosen. And as you can see, with the first and the second anti-epilepsy drug, you have got about 60 to 70% of patients who can attain seizure freedom. And once you have gone third, fourth, fifth medication down the line, the likelihood that you will become seizure-free becomes slimmer and slimmer. And the first study came from Glasgow, from Professor Brodie, and he had the data of thousands of patients from 1982 onwards. But even as the new anti-epilepsy drugs have come on the market, unfortunately, this figure hasn't changed. And essentially, your refractoriness is very much driven by what is the underlying cause of your epilepsy. And so it is not surprising that Ring 20 probably features in the right-hand side of this slide. Now, there are some sporadic case reports, actually. So there was one case report from Turkey, where oral lacosamide in Ring chromosome 20 patients in a 25-year-old female, that seemed to work quite well, and she became seizure-free, almost seizure-free for 3 months. Now, when we look at these case reports, we always have to understand that there's always a publication bias. People will report only positive things, and people will have tried a number of things before, but because nothing has worked, people are not going to come and report those. So there is always a publication bias. There may be many more patients who have tried lacosamide, but it hasn't worked. But when you see something positive, you want to try that. And so I think there is a positive publication bias, but a good news that somebody had a benefit from oral lacosamide. There is some thinking that whether the Ring chromosome 20 is an epileptic channel disorder, because the chromosome 20 has got 2 specific channels that are implicated in certain types of epilepsies. And because the commonest place where the ring is formed is this chromosome 20q, which is the long arm of chromosome 20. And there are 2 important genes in that. The first one is CHRNA4. This is a gene that is implicated in genetically driven nocturnal frontal lobe epilepsy. And the second type of gene, KCNQ2, so that gene is implicated in early onset neonatal seizures. So there was some hypothesis, actually, whether these genes deletions are epileptic and whether then targeting the treatment for these gene disorders might be helpful. But there isn't any clinical evidence, actually, that works, really, because the seizure types are quite different. The seizure phenotype is different. The onset is different. But that did not stop some people from trying a medication on potassium channels, because as you saw, the first one, potassium channel mutation, KCNQ2, that mutation is implicated in benign familial neonatal seizures. So these children tend to have seizures in the first 4 weeks of life, typically in the first 2 weeks. They come under very rapid control, and usually they grow out of their epilepsy by several months of age. Rarely ever they will carry on having some seizures subsequently. And overall, their developmental outcome is quite good, which is not the phenotype that we are seeing in Ring 20. But there was one study where they tried a medication specifically working on potassium channel, and they found that that medication, again, might have been beneficial. And that's why the postulate came, actually, whether there is a role of different channels implicated in how this epilepsy comes about. But we know that the mechanisms of epilepsy in Ring 20 are much more complex, and there is not a single mechanism. So this ezogabine was the first potassium channel opener drug, and they tried that medication. And they described a case of an 8-year-old boy who had significant improvement in ezogabine. Now, in the anti-epileptic drug market that we have currently, there isn't one specific potassium channel opener medication. And there was one retigabine, which has now been discontinued and taken off the market because of the retinal toxicity. So essentially, there is no consistently effective medication. We know that this is drug-refractory epilepsy. So what are the other options? So coming to the second part of the treatment, dietary treatment. So ketogenic diet is a high-fat, carbohydrate-restricted diet with adequate protein. And the idea is that you mimic the effects of starvation. And during the process of metabolism of the fat with restriction of the carbohydrate, you generate ketones. And these ketones have got the ability to modify seizure activity. So there are 4 types of the diet, and the classical diet, MCT diet, modified Atkins diet, and low glycemic index treatment. The first one is much more restrictive as compared to the last 2 ones, and they're more easily manageable. When we look at the typical composition of the diet, the yellow bit in that is your carbohydrate. So generally we eat at least 50% of our calories are coming from carbohydrate. And as you go into classical diet, all that green bit, so predominant calories are coming from fat, and you have got only about 4% calories coming from carbs. And in the modified one, you have got slightly higher carbohydrate allowance, slightly more flexibility, but still high fat content. And since 2000, just to make the diet less restrictive and probably still efficacious, other modifications have come up. And so low glycemic index diet is where you have about 10% carbohydrate allowance, while with the modified ones, again, you have got about 5% carbohydrate allowance, but still high protein and high fat. They do provide a degree of flexibility and palatability, and you don't have to measure anything except the carb content of the food, while in the classical and MCT one, you have to measure the fat content quite carefully. And they are individually prescribed diet. They require quite long support from the expert dietitian and very careful monitoring. We know it works, and there was this trial from Great Ormond Hospital because we are more and more driven into evidence-based medicine, so we want evidence that it does work. So they had 145 children, and they were randomized into two groups. So some children started the ketogenic diet straight away as soon as they reached the phase of consultation and starting the diet. And 72 children acted as controls, which means because you cannot randomize ketogenic diet, you can't blind the ketogenic diet. So they acted as their own controls. So the 72 children remained on their anti-epilepsy medication, but then started the diet 3 months later. So they did have access to diet afterwards. So at 3 months, the baseline seizure frequency in the diet group had reduced to 62% of their baseline, while in the control group, it had actually gone up to 137%. And 50% reduction, which is the sort of standard endpoint of measuring success of any treatments in epilepsy, was achieved in 38% of patients who experimented with the diet, and it was achieved only in 6% of the controls. And there wasn't any difference between what sort of epilepsy you had, whether you responded or not, actually. And this is the same data just in the bar diagram form, that in the control group, you had more seizures, and in the ketogenic diet group on the right-hand side, you had improvement in the seizure control. Similar study published also from India, and I'm going to skip that for the want of time. There aren't any reports of ketogenic diet in Ring 20, but I'm thinking actually, why not? And I think there isn't any reason why it wouldn't work, really. The Ring 20 is not associated with any of the metabolic problems that preclude starting ketogenic diet therapy. And it was quite nice to know that actually David had already tried the diet, which I wasn't aware, actually. But there aren't any reports of Ring 20 chromosome being treated with ketogenic diet again in the literature review. And I don't really see why it wouldn't work and why more people wouldn't be willing to start the diet. And often when you know that the drugs are not helping, you can have polytherapy with non-drug option. And that non-drug options might be a combination of ketogenic diet and vagus nerve stimulator with or without maybe 1 or 2 anti-epileptic drugs rather than 3, 4, 5 anti-epileptic drugs. So polytherapy doesn't have to be just a drug polytherapy. You could have a polytherapy with non-drug therapy. Now, cannabidiol, another armamentarium, and I think many of you will have come across cannabidiol, and there has been a lot of publicity about cannabidiol, especially over the last few years, and people wanting to try cannabidiol for refractory epilepsy. And lots of publicity has come from the USA. So we know that cannabidiol is quite an old product, and it has got more than 500 different compounds. And out of those, we are interested in terms of epilepsy only with the compound called THC and cannabidiol. Now, cannabis has been used as an Indian hemp in a patient with epilepsy way back in 1868, where this 40-year-old person actually became seizure-free on the experimentation with cannabis product. And seizures came back when the supply ceased, and then he became seizure-free again when the supply was restored. So it has been used for a variety of conditions over the centuries. And so the CBD, which is cannabidiol, it is consistently anticonvulsant when you look into the animal studies, while the THC component, that is what we are concerned about, people experimenting, is more commonly associated with psychotropic problems. And that's why this may be one of the compounds that is responsible for psychotic tendencies that you see in people experimenting with cannabis. And the anticonvulsant effect of THC is quite inconsistent when you look at the animal studies. So the Cochrane review, which is the standard of medical evidence, that looked at 4 different studies and did not identify any obvious evidence of efficacy, but they did identify that it was safe to be used and well tolerated in the adult population at that particular dosing level. Now, the bottom one is a Facebook survey, one of the most scientific methods nowadays to get the efficacy. And they had 19 parents surveyed in the state, and 53% reported over 80% reduction in the frequency of seizures. But majority of these children had a genetic diagnosis called Dravet syndrome, and that certainly seems to be a condition that consistently responds to cannabidiol. So we had a UK open label trial, again, that was conducted at Great Ormond Street Hospital, and Professor Cross had 25 children who had access to cannabidiol given on a compassionate use basis. And we had 40% responder. And I think it's again important to know that 40% figure never changes whichever new anti-epilepsy medication comes on the market. It is always 40%, okay? So it is not a magic bullet, but it does provide some hope for the future that because it has got a novel mechanism of action, it doesn't work like any other anti-epileptic drugs that we know of, and that may provide a little exciting mechanism to explore in the future. So neuromodulation, I'm not going to talk, but there was one paper about deep brain stimulation. So essentially, what we already know that this is a rare disorder, probably underdiagnosed. We know that this is associated with drug-refractory epilepsy, and polytherapy often is required. What I'm proposing is polytherapy could be in the form of not drug polytherapy, it could be non-drug polytherapy with or without drugs. We know that this is associated with epileptic encephalopathy, so whatever we can make a difference to epilepsy control probably will have some positive impact on the cognitive aspect as well. And because there is no consistently effective medication, we do have to look at other strategies such as ketogenic diet and VNS. So I think just back again, why not KD? And that's because, I don't know, yes, well, because I lead our ketogenic diet service, and I also work with Matthew's Friends, which is the organization that supports the ketogenic diet. It's a charity, and I'm on their medical board. And I think we can see the clinical benefits of the diet on a daily basis, actually. So I don't really see why it shouldn't be tried in Ring 20 chromosome, rather than why try. Okay? Thank you.